Hi, my name is Sedoc Jørgensen. I'm a psychologist at the Psychiatric Research Unit in Region Zealand, Denmark, and I'm also a PhD student at the Faculty of Health and Medical Sciences at the University of Copenhagen, and the first author of the paper that is the topic of this video presentation. The video abstract will present our recent publication in Family Process that is titled Burden and Treatment Satisfaction Among Caregivers of Adolescents with Borderline Personality Disorder. On behalf of the co-authors of this paper, Professor Jakob Storebø, Professor Stig Poulsen, and Professor Erik Simonsen, we thank you for your interest in our work and we look forward to present our findings to you. Borderline personality disorder, or BPD, is a severe mental disorder that's characterized by instability in affect, impulses, and behavior. It is also a disorder with symptoms that highly affect the families and caregivers. For instance, BPD is associated with self-harm and suicidal behavior, anger, impulsivity, and fear of abandonment. Therefore, it's not a surprise that caregivers of people with BPD report of significant feelings of caregiver burden. BPD usually manifests itself during childhood or adolescence when the child still lives with his or her caregivers. Some studies have found that parenting adolescence is viewed as the most difficult parenting stage by the majority of parents, and caring for an adolescent with a severe psychiatric disorder like BPD adds pressure on the caregiver. Therefore, it is of utmost importance to conduct studies that elucidate aspects related to caregiver burden among these caregivers in order to devise appropriate interventions. A systematic review was recently published in Family Process on interventions for family members or caregivers of people with BPD, and this review only identified one study on caregivers of adolescents with BPD, which clearly shows how under-researched this topic is. A randomized controlled trial on mentalization-based group treatment, or MBT-G, compared with treatment as usual for adolescents with BPD, was recently conducted in the Child and Adolescent Psychiatric Services of Region Zealand in Denmark. In the MBT-G arm, caregivers were offered 6 MBT parent sessions, and in the treatment as usual arm, caregivers were offered non-manualized standard care. As you can see, the trial entailed interventions for the caregivers, but originally we did not consider evaluating this program on caregivers' outcome of treatment. So this current exploratory and retrospective study was designed for that purpose and then nested within the trial. 3 months after the adolescents had received 1 year of treatment, we contacted all 111 caregivers and asked them to participate in this supplementary study. 75 caregivers agreed to participate, and we collected information on caregiver burden and satisfaction with treatment. And we also collected socio-demographic information on the caregivers, namely their age and their relationship to the child, educational background, and employment status. Given the retrospective design of the study, we unfortunately do not have any of this information at baseline. Due to the adolescents' participation in the trial, we had assessments on severity of BPD at baseline and at end of treatment, and whether they completed treatment or dropped out prematurely. To briefly describe our sample, our 75 caregivers consisted of biological mothers, biological fathers, and paid caregivers. Paid caregivers were either foster parents or so-called contact persons. In Denmark, a contact person is a municipal worker that stood in as a parent substitute. For information on marital status, educational background, and employment status, we refer you to the paper. The 75 adolescents had a mean age of 16 when entering the trial, with a range of 14 to 17. So what we found in our caregiver study was, for one, that the level of caregiver burden was really high, and the level of satisfaction with treatment was mid-range. Compared to previous studies on caregivers of people with BPD, our sample of caregivers scored a little bit lower on burden, but it's important to remember that we measured burden after the adolescents and the caregivers had received 1 year of treatment. Our study also suggests that biological parents, and especially biological mothers, feel more caregiver burden, but also more satisfaction with treatment. And that there might be an association between BPD severity and caregiver burden and satisfaction with treatment. Those caregivers whose adolescent had more severe level of BPD pathology might need additional support. We did not find any association between treatment offer or whether the child dropped out from treatment and caregiver burden or satisfaction with treatment. So what can we use this information for? Studies like these are important in order to generate hypotheses on which aspects of caregiving that might lead to caregiver burden, and subsequently to devise appropriate interventions that target these aspects in order to reduce caregiver burden. We believe that this study is an important first step towards developing effective treatments for caregivers of adolescents with BPD. Thank you for listening, and we hope you enjoy our paper. And if you have any questions, please reach out to us.